Hello, and welcome to the Smart Injury Doctors Podcast, the injury market's top program for doctors, lawyers, and insurers who want to gain greater insight on how to improve patient recovery results and deliver better services in the U.S. injury market. Please welcome your host, Dr. Jeffrey Allen Kronk.
Hi, welcome to today's program, doctors. Today, what I want to do is just touch on marketing. Marketing. Everybody seems to want to know more about marketing. Marketing is simple once you understand it. Marketing is how you are perceived in the market. Marketing is how you're perceived in the market. So guess what? Everything you do is marketing. Everything you do is marketing. Everything you do. Now, I have a Smart Injury Doctors training program. We help doctors become incredibly unique in the spinal injury market so that they can go out to employers or comp carriers, attorneys, medical doctors, the general public, everyone and anyone, so that they can go out and they have a very, very specific ability. They have a specific competency. And that competency is that they can take and fully diagnose spinal injuries. They can accurately do it very quickly, and then they apply the right treatment to it to get great recovery results. They also document in such a way that the patient, the attorney, the insurer, everyone involved has an easy time determining the benefits that the patient may be entitled to. That's what they do. And so when you're looking at marketing, though, everything that you do is marketing. Marketing will attract what you want and it will repel what you don't want. But when I say everything is marketing, your building is marketing. The look of your building is marketing. What does it look like? What does the outside of your building actually look like? If I drive by your building today, what does it look like? If you drive by it today, what does it look like? If you take two people that don't know your clinic and say, hey, let's drive by my clinic, tell me what you think about this clinic. What's the first perception you get of it? Guess what? You're marketing. If I just said to you, marketing is perception, it's how you're perceived in the market. So everything you're doing, the front of your building is marketing. What you have on, if you've got any kind of communication out there on your sign is marketing. If you've got communication on your windows, it's marketing. When a patient comes into your office, what do they see? What materials do they see? That's marketing. Okay, everything you do is marketing. And there's internal marketing, which is everything that the patient sees. You got to remember, in the injury world, if you have 1,000 patients in your database, there's 110 injury incidents, either auto or work related, in that database every single year. If you have 10,000 people in your database, there's 1,100 injury incidents in that database every single year. But what are these people that have already used you? What have they perceived you to be about? Have they perceived you to be about nutrition? Have they perceived you to be about wellness care? Have they perceived you to be about injury care? How have they perceived you? Right? And when they perceive you, if they perceive you in injury care, how have they actually perceived that you're different from everybody else? Because remember, when a patient comes into your office, and they get a result with your office and they come through your process, you are marketing to them. Every visit you're marketing to them because they're perceiving how competent you are. They're perceiving how professional you are. They're perceiving how organized you are. They're perceiving how rapidly and well you communicate. They're perceiving how well your staff communicate. They're perceiving how well your clinic allows you to change appointments. They're perceiving whether you have home care, rehab, or not. They're perceiving what you have up on your wall. They're perceiving the cleanliness of the clinic. They're perceiving the cleanliness of the bathrooms. They're perceiving everything. And if they get a great perception of you, then guess what? They become mini marketing units for you, which is exactly what you want your patients to be. This is all internal marketing we're talking about now. You want your patients to be internal promotion units for you. You want them going out, talking about your clinic, talking about how organized it is, talking about how great the injury recovery is, talking about how great your diagnostic capabilities are, talking about how you don't miss ligament injuries, talking about how you can actually determine the most common cause of what most patients suffer from, which is chronic neck pain or chronic back pain, you are able to accurately diagnose exactly what's causing that, where nobody else could. That's all perception. And then there's external perception. You don't think about it, doctors. When you go to the grocery store, people are perceiving you. When people ask you what you do and you're in a hoodie and you say, well, I'm the top I'm one of the top spinal injury experts in this area, what we focus on, our primary focus is on injury care to the spine. We're really good. Most patients have a 50% chance of recovering from an injury. That's usually because the doctor who's treating them does not know how to diagnose their condition. We we find the condition that most people have that's causing them chronic pain, and we find it quickly, and we're able to do something about it. Okay, but how are you dressed? I'm going to give you permission in 2020 to buy nice clothes. What do you drive? Whatever you drive, it creates a perception. If I'm going up and I want I want injury referrals from a medical doctor, from an urgent care center, what I drive matters, because I'm being looked at upon how I drive, how I dress, how are my manners. All of that is marketing, right? When I send out a report, and I send out a report to a medical doctor, I send out a report to an attorney, I'm marketing. How I approach a deposition and how I show up, I'm marketing. How I show up at court and how I show up at trial and how organized I am, how I'm dressed, what I drive up in, I'm marketing. Once you understand that everything that you do is marketing, and you get to decide how you want to be perceived in the market, you totally get a chance to decide that, right? Marketing is not hard once you understand it. And just to think that marketing is, well, I'm going to put an ad in the paper, that's like a very minimal understanding of marketing. So all I wanted to do today was kind of blow up your understanding of marketing a little bit. Blow it up so you really get the full idea of what it is. And the fact that everything that you're doing is marketing. When you're training your staff, I have a Smart Injury Doctors training program where I have doctors train their staff. Guess what? That is the most awesome marketing you can do internally. Because if you can't market to your staff, to enroll your staff into understanding why and how your clinic is so unique and why patients should be coming in, you're going to have a hell of a time going out to medical doctors or attorneys and doing the same thing. It's not going to be as successful. So again, everything that you do is marketing. When you show up for an attorney, how you dress, what you're presenting, how you present it, it's all marketing. What's your follow-up? What's your follow-up? In other words, what are you sending them after you've met with them? What are you sending medical doctors after you've met with them? That's all marketing. And so it's all how you want to be perceived in the market. And marketing is simple because, like I said, you get to decide. You get to decide. I mean, that's called a marketing strategy. Marketing, how I want to be perceived in the market. Marketing strategy, how I'm going to strategize to get that perception into the market. Once I strategize, that develops a marketing plan. And that marketing plan is the action steps you're now going to take to make that strategy a reality. And that's all marketing is. And it's easy. And today, if you want to grow a big injury practice, you want to start to improve your numbers of people who are coming into you and your ability to get your message out into the market, we have a Smart Injury Doctors marketing program that comes with the main system that has all done for you materials that you just go out and you start to use. And it's super, super simple. So marketing itself, especially for an injury practice, should not be that hard. Doctors, if you're running into problems with marketing or you have questions, you have things that you struggle with, put your comments down below. Put your comments in, because that's what we look at in order to do more podcasts in the future. So like all of these podcasts, I just take a simple concept and start to riff on it a little bit, talk about it a little bit, and hopefully open up your understanding or idea about it so that it's a little bit simpler for you to understand and apply. Doctors, I thank you always for giving me your attention on these podcasts, and I look forward to seeing you on the next podcast. Thank you.
You've been listening to the Smart Injury Doctors Podcast, the #1 audio production show for professionals in the U.S. injury market that want to deliver better injury services to the patients, clients, or insureds they serve. If you like what you heard today, please leave us a review and don't forget to join us on our next program.